We're going to do the cervical spine. We want to make sure remember, if you've been sitting at the computer all day, head guns forward, head tilts back. A lot of times you'll have a bunch of compression there at the base of the skull. So what we want to try to do is release the tension at the base of the skull and then try to bring the head back over the shoulder position, okay? So the first thing we're going to do, I always honestly personally like to do the foam roller in that mid-back, just to try to make sure we're not trying to jam up the mid-back when we do this, but you should have already done this anyway. What we're going to do is you're going to take a little ball, okay? You can use a tennis ball, a cross ball, myofascial ball, which we have on our website. What we're going to do here is now we're going to work on the suboccipitals, right there at the base of the skull. This is the first one, and then we're going to transition to a point that's going to be right there called like your levator scap. So you're going to put it right here at the top part of the shoulder blade. So I wanted to show you before we get on the ground because then it's hard to see. Lay on her back, and she's going to put one of the balls right there at the base of her skull. We're going to work one side at a time. So what she's doing here, she's just gently letting the weight of her head just sit there and kind of gently massage the base of her skull. This one takes a little while for you to kind of get used to, just because it rolls around. It's a ball and your head is round too, so it's kind of hard to kind of keep it in position. So do what you can. Sometimes you might need to help pick your head up off of it so you don't have all the weight there, and then it just kind of flounders around. So once you get the hang of it, this is a lifesaver, especially for people who have headaches or severe neck tension from sitting all day. So this is just a great way to help massage that tissue tension at the base of the skull position. So she's going to move it right there to that upper part of the trap area, and now she's going to try to bring her butt off the ground to drive some weight down into that shoulder, and it typically doesn't have to take too much. It's a nice little trigger point that most people have because their arms are gone forward, their mouse hand, etc. It kind of pulls that shoulder blade out of position and really affects this one spot. So this is one that we have people work on every single day. Just sit there, breathe. You can move the arm. Remember, we like the pin and stretch position. She can do it this way. She can lightly kind of move her head around. Just kind of do whatever you can, whatever feels like it's digging into that area to release that tension right there, levator scap position. She's still going to stay on her back. We're going to work on to the stretch position. Remember, dig that tissue out. What we're going to do is I like to use a foam roller for this one. She's going to pick her head up and she's going to let it just go right there, kind of the top part of the skull. And we're working on the chin tilt position, like the yes type movement. So she's just going to think of head up and then head back down, allowing that chin to kind of go to her cervical spine, her neck. Remember, she just got done digging around in that whole suboccipital area. Now she's just sitting there kind of stretching that tissue out. If one side feels tighter than the other one, I like to add a little bit of a rotation of the head and then do that same position. Kind of isolates one area a little bit. Go both sides, kind of feel which side you like to have more. This is the tilting position. Now we're going to work on the chin tucking position. Okay, then she's going to take the foam roller away, go ahead and lift your head up. Now you can just go right to the ground, okay? This is a nice, easy way. She's going to think of chin tucking. This one is not very flattering. It's kind of like the double chin type position. So what she's gonna do is like really try to tuck that chin just like that. Now, if you have a position where you've had some neck issues, some postural issues for a while, you might need a little pillow or a pad or something just to put at the top of the head to help with this position so you're not like stuck up in that weird turtleneck position. We'll work on it. This will slowly get better to hopefully you don't need it anymore. But if your neck is hurting the whole time, I don't want that. So there again, she's working on the chin tuck position. Just sit there and work on that movement. Now, remember how we always like to do like a push, relax, push, relax? So she's tucking here. She's going to put her hand kind of on her head and kind of like try to push her head forward into it. Right there, push her head into the hand and then relax and then let the head kind of fall back a little bit further down into that stretch position. This is what we call pels and rails, where you're trying to really push into that movement. You're fighting that stretch and then it should relax into it, okay? Next is cervical spine rotation. So I really like the pad for this one because it helps you so you don't extend the neck, kind of jam up when you do this. So really think about getting long, pretend like she has a string, pulling her head to the top of the wall or whatever to the other wall. And what she's gonna do now is rotate, keep her chin from like coming up. Nice. So what she's doing here is just gently rotating back side to side. Now, you know how like when you're in the office getting it treated and I'm typically heavy on the table, I'll typically hold my hand here and have you resist, so push into my hand and then relax, see if you can go further. You could do the same thing here. She's just gonna put her hand there, lightly rotate into the hand, about 2 or 3 seconds, and then relax. See how she can go further each time? Do about 3 times, and then when she's there, stop, take a deep breath, relax. I want you to think of breathing as like a reset button. You're challenging that neck rotation as much as you can. Your body's gonna try to wanna fight you. Breathe, tell your body it's okay to go through that full range of motion. Just make sure you go to the other side. Now we're gonna do the activation part, trying to strengthen it up. So we're gonna show you how to do it with no equipment at all, which is just the ground. And your head is gonna be the weight for this one. So if you forget, honestly, it's the same movements you just did with the chin tuck. You can even do the chin tilts and rotation. We're mainly gonna focus on chin tucks because that's the biggest bang for your buck, and then neck rotation. So what Haley's gonna do is go up into a push-up position. If sometimes a push-up's just too darn hard, just go to your knees. Okay, main focus is here. Because remember, the head is the weight. So what she's gonna do here is now chin tuck. She's gonna really tuck, try to get straight, really activate this muscle, and then relax. Chin tuck. So she's pretending like her head is on a slide. It's sliding one way and relaxing. What not to do, not to extend back this way. We're not trying to do this position yet. It is tucking the chin down to the spine and then bringing the head, ears back over the shoulder. 10 reps. I like to honestly, when you come up, pause for a second and then relax. So this is your chin tuck position. Now she's going to come to a good chin tuck position. You don't have to go as far back. And now what I want her to do is rotate her head and then go the other way. Nice. You will feel the neck tension quite a bit. Now, once you start getting tired and fatigued, when you rotate, your eyes will go there and your chin will stay down. I don't want that. I want your chin tucked and then rotate as far as you can, almost in a line, okay? Because if not, if you kind of go back, you're gonna jam up that neck a little bit more, and it's gonna cause more problems than good. The red one, just in case they have it. So now what you're gonna do is you're gonna take a band. It could either be one of these pull-up bands, a little bit more aggressive on the head, or just a regular traditional TheraBand, okay? What you're gonna do is you're gonna do the same exact moves there, but I like to have these there because if you're at work, you see the darn thing, you could do this as part of your micro breaks, which we'll go over in the future, okay? So what she's gonna do is do literally the same thing. She's gonna put the band on top of her ears. Perfect, good. Now what she's gonna do when she's here, she's going to straighten the arm. Good. And then now chin tuck there. Now sometimes just holding this position is like holding a plank. You're just working that tissue just isometrically. Now what she can do is relax, let the band win, and then bring the head back. Do that chin tuck. Good. Hold, let the band win, chin tuck. So that's one way of doing it. Or she can chin tuck, hold the chin tuck, bring the hands closer to the face, and then now straighten the arms. So now you're having different tension, but you're doing it basically like a tricep type movement. So you can gauge how hard you want to do if you're really pushing hard, or you can take that tension off of it. So this is working pretty much her suboccipitals, her neck, and honestly her thoracic spine a little bit also. So this is a big postural move here. There again, you can do the same thing with this bad boy, just above the ears, tuck the chin, you can straighten the arms, you can kind of let the head move. You're just doing the same thing, but with what you got. Have the neck rotation. So same thing, she's gonna have that position, but she's now going to switch hands. There you go, it's gonna make a nice little X pattern. Now what she can do is have one that's really strong, and she can take tension off of one of them, and then now rotate toward the one other way. There you go, rotate here, and now this one has a lot of tension on it, so it's giving her resistance with that movement, okay? Good. Go the other way. Perfect. So there again, this one's a lot harder. You're not gonna get that in range of motion. First off, you're gonna feel awkward, you're gonna look weird, look like a backwards Rambo, but try this out, okay? If not, you can use it here. Cross that arm, same thing, nice little tension, and then now what you're gonna do is rotate and relax. Rotate and relax. Try this out, super fun. MSA approach for the neck, cervical spine. So especially if you're sitting at a desk all day or traveling, you need to do this one, especially at the end of the day. It's gonna give you great success.